In this next lesson, we'll go over OSHA bloodborne pathogen standard and universal precautions. As a healthcare professional, you need to understand the basic practices of infection control to prevent infection in a medical office setting. OSHA enforces the bloodborne pathogen standard of 1991, but it's the responsibility of a qualified medical office professional to ensure compliance of these laws. To ensure that biohazardous materials do not endanger people or the environment, the OSHA Bloodborne Pathogen Standard of 1991 dictates how you must handle infectious or potentially infectious waste. Infectious waste materials must be appropriately discarded or held for processing in biohazardous waste containers. These wastes include, but are not limited to, blood products, body fluids, human tissues, vaccines, table paper and linen, used scalpels and needles, used gloves, and disposable instruments. Most offices are now using disposable paper gowns and drapes, but you'll still come across some offices that use cloth linens that must be laundered. There are certain rules that apply to the laundering of cloth linens that are soiled with potentially infectious materials. If your office is using an outside company to launder your linens, be sure that that company understands the rules that apply. Medical offices will also use outside licensed waste management services that are approved by the EPA to dispose of medical waste. The waste management company can provide instructions for preparing your items before pickup, but you'll need to understand the different types of biohazardous waste containers and what types of material go in each container. Biohazardous waste containers are available in a variety of designs, and they're actually provided by the outside sterilization and waste management companies that pick up your waste to dispose of them. In healthcare settings, you'll notice that more than one design is used. Each design is intended for a certain type of waste. Bags or containers that are red or have a biohazardous waste label are typically intended for blood or body fluids, such as used dressings or gowns that are soiled. Boxes with biohazardous waste labels that can also sometimes be lined with red bags and used for disposable gowns, examination table covers, and similar items that may be contaminated with blood or body fluids. You'll have a rigid, leak-proof, and puncture-proof sharps container. They are red and they have a biohazardous waste label. These are for lancets, needles, and other sharp objects to make sure that they do not poke you or puncture your skin and infect you. All of the different containers have a lid that you must replace immediately after use, and you have to be sure not to overfill the container. You must replace it when it's 2/3 full. A biohazardous waste containers must have a fluorescent orange or orange-red label with the biohazard symbol and the word biohazard in a contrasting color. When handling biohazardous waste, you want to be cautious and follow these guidelines to handle them with care. Always wear gloves. Place the biohazardous waste in the appropriate biohazardous waste container immediately or as soon as possible. Keep your biohazardous waste container close to the place where the waste material is generated. Keep the containers closed when not in use. Close them before removing them from the area of use, and keep them upright to avoid any spills. If outside contamination of the primary container occurs, place that container in a secondary container to prevent leakage during handling, processing, storage, and transport. Drop, do not push intact contaminated needles into the biohazardous waste container for sharps. This is a quick way to lead to an accidental needle stick. To avoid accidental puncture wounds, never break off, recap, reuse, or handle needles after use. If there is a danger of biohazardous waste puncturing the primary container, place that container in a secondary container. Do not open, empty, or clean reusable sharps containers by hand. When they are 2/3 full, discard disposable sharps containers in large biohazardous waste containers.